The June 14th Douglas County Board of County Commissioners work session here at 4 o'clock. Today, we're thrilled to have Cottonwood Inc. to provide an update and overview of their services. If you're not familiar, the county does provide funding for Cottonwood Inc. So we're glad to hear from them today. If you have not attended our work sessions in the past, we do not take any action at our work sessions. They're for informational purposes only. We don't take public comment. If you would like to provide comment on anything you hear during the work session, you're invited to our 5:30 business meeting, and you can provide that comment during the public comment section. So with that, I will turn it over to Sarah to introduce our guests and get us kicked off.
I'll just turn it over to you, Colleen, to introduce your team and who you brought with us and have us get started.
Oh, that sounds good. First of all, I'm Colleen Himmelberg. I know I introduced myself to each of you. I'm the CEO at Cottonwood Incorporated, just wrapping up my first year here as CEO with Cottonwood and in Lawrence as well. So I'm thrilled to be here, thrilled to be part of this amazing community. Sarah and I have had lots of conversations about how fortunate we are. Have a wonderful team that came with me. This is Kara Walters. She is the Administrator of Services. Pretty much anything that happens that isn't financial related, Kara's managing and directing. She's been with us 35 years, so very long-term employee. Jessica Wood, who is our CFO. She's been with us 10 years and is an amazing asset to the organization. Eddie Brightwell is our Director of Community Relations and Fundraising. And she has graciously volunteered. Actually, she told me she's going to run the slides, which is awesome. And here in the audience, we have a cadre of our board members from our foundation as well as our board of directors. They are so intertwined in the day-to-day operation, not the day-to-day operations, but in the things that we do, so supportive. And have been an amazing asset to me as I'm onboarding and transitioning, huge support system. And when we told them we were going to do this, they said, well, we want to come. So we sent them the date and they want to be here. So I appreciate you all so incredibly much. It's been a wonderful past year. So about Cottonwood, we'll go ahead and just run through. I know you guys all saw the slides, so we're going to give you some general information, just as a reminder about all the things that we do. Sometimes we can be a little quiet and not toot our own horn as much as we probably should, but here today we get to and you notice the red and black. I don't know if anybody's been by our buildings to see the new paint and the new signage. It looks fabulous. That's one of the kind of modernizing things we've undertaken, and it looks so good. It's really, really slick. You know that she goes to presentation. Yeah. You guys. I got help here. Yes. Okay, so this is obviously just our logo, but one of the things we talk about on a regular basis and has been quite evident to me is the mission of Cottonwood Incorporated, and that's to help individuals with disabilities shape their future. Right. And that mission is super critical to pretty much everything we do every single day and how we interact with the individuals that we serve. So you'll see that intertwined throughout the different services that we offer, and we'll walk through each one of those as well. But you can see our history goes back to 1962. A group of parents in the antiquated language, you can see how far we've come. Patrick, I know that'll resonate well with you being part of the school system and such, but how far we've come from that particular language. But really this group of parents looking for activities and things for their children to do when they graduate high school, because what happens when the institutions after the ADA are no longer that desired choice and they want more acclimation, they want more interaction into the community. This was started in relationship with Douglas County. That comes next in the next slide. 1969, we became chartered, formed a corporation, and obviously worked with Douglas County to make that happen and to continue to grow it. Mrs. Surf, Petey Surf, who was a phenomenal philanthropist from what I gather, purchased the land for us so we could build a building and really have a permanent home for Cottonwood. This is what we look like today. And this is something, Karen, you and I were talking about. You don't realize the expansiveness of the facilities because you don't really see it from the road, how far it goes back and how much goes on in there on a day-to-day basis. But we moved into this building in 1972 and just celebrated last year our 50th anniversary. So what a fun year for me to be able to start. We got to do a lot of celebrating and have a lot of fun. Just really honoring everything that Cottonwood has been to the people we serve and certainly to the community. Our service area, Douglas and Jefferson County. Those are the areas we're responsible as the CDDO, which we'll talk about coming up and kind of how that works officially. And then we have 7 core services that we offer, and we'll talk about each one of those briefly individually. Those are very broad in scope, but as that mission drives what we do, they're very person-centered and individualized for the folks that we serve based on what they want, what they like, what they need. So it doesn't look the same for every single person. Our CDDO is the Community Developmental Disability Organization. That came through the Disability Reform Act in 1995 and Cottonwood was selected by the state to be that developmental disability organization for our 2 counties. What that means for us and our commitment to you almost as an arm of the county is that we are the single point of entry for individuals that are coming into HCBS services or qualifying, applying for those services. So we do the assessments and all those things and then help folks navigate the waiting list, unfortunately, which is about 10 years long in the state of Kansas for someone to access services through the waiver. But that CDDO is a critical part of helping people access services. And then they manage the provider network in a way. We just had a audit, so to speak, by the CDDO. They came in and did our audit along with licensure from the state. So they really are watching not just us, but every provider in the 2 counties. And making sure that our quality is on par and we are dotting our I's and crossing our T's. And they're not easy, are they? They don't go easy on anyone for sure, but it's certainly a good thing.
Colleen, can I ask you a quick
You
question,
bet.
please? This is Commissioner Reed. I'm just curious. I didn't realize you served Jefferson County too before these slides. Can you just give me a sense of how many such organizations there are across the state? You know, if we're only a 2-county CDDO, do you have a sense of how many there are and how that compares to other sort of collections of county under them?
Approximately, thank you. Roughly 27, that kind of gives or takes a little bit occasionally. So yeah, each CDDO has a designated area of responsibility. There are some that have 10, 12 counties they're
Sure.
responsible for, but the population is low.
Right.
So
Thank you. I'm also curious, because you mentioned a wait list here. I don't know if that's unique to the more populated areas or if it's sort of a struggle that they're experiencing across the state. I'm just curious. I mean, maybe the question it leads me to is, at the statewide level, who is it that's deciding sort of who these CDDOs are, which counties they encompass, and whether or not that's a good spread, for lack of a better phrase, in terms of capacity and population?
I believe it would be the Kansas Department of Aging and Developmental Services that are over that. And I haven't, I've been around this for quite a while, and that's not anything that I've ever heard concerns around the allocated regions that CDDOs have. For highly populated counties like Sedgwick County, that is the only county that CDDO is responsible for. So I think that there was a lot of consideration for that. So that's not something I've heard. The waiting list, as far as getting funding goes, that is a centralized waiting list that the state manages.
Yeah.
That's a waiting list for funding. And then there may be interest lists attached to specific providers for someone who wants to move to another provider, but perhaps they don't have an opening. But the actual funding waiting list is a state managed list.
Got it. Thank you for that clarification. I apologize.
Those
for
are great questions. So
misunderstanding.
feel free to stop us as we go along and, ask questions for sure. There's a lot of complexities in this industry and a lot to understand that folks like us just do behind the scenes, to manage how things go. And that's every industry, but feel free to ask any questions. So one of the really, really neat, and I think, and I can still feel somewhat subjective since I'm still a newcomer, so to speak, but a program that is super, super unique here is JobLink. That is the division that provides employment services to individuals that are, Albert, for example, is at Culver's. We've had over 3,000 individuals access jobs in the community since the inception of the program. Right now we have 260 approximately. I don't know if we updated that number since yesterday. We had 5 new jobs. So it continues to grow, but we have people employed throughout the community. And that is a huge kudos to Douglas County in and of itself. The acceptance, the way that employers work with us and allow our job coaches to come in and help teach and train folks is just by far, I've not seen it in my past career to this level. And that's definitely something that this county should be really, really, really proud of. The other piece that makes this such a huge success is our transportation system and the support that is provided. One of the biggest barriers across the United States for individuals with disabilities to access employment is transportation. Many don't drive, and as a parent or guardian or support system, the ability to transport someone to a part-time job back and forth, it can be very limiting. If you're working full-time, 8 to 5, trying to get Albert to Culver's for his 4 o'clock shift can be really, really challenging for families. So that transportation system is the folks that I work with, that I work with through accrediting agencies and stuff are just floored. Like, send us how this works. They want to know. And it's really, really impressive. So definitely something to be proud of. The next one is Cottonwood Industries. And I think we are so well known for our STRAP contract through the Department of Defense, which you see a picture of there in the middle. But we also do a variety of other contracts that are product assembly, mailings, kittings, packaging, all sorts of different projects that we can access from businesses that can bring that work into us. You can see flow, packaging, some things that looks like probably from, is it Nestle now? What's Nestle? So it's the kibbles and bits. But we do a lot of things like that. And going forward, those are things we want to diversify. We want to invest in, change, grow, and diversify the types of work and more profitable work, honestly. We talked about, and I know when I was in Sarah's office, her predecessor had the strap, like I'm not worried about Cottonwood because they have the strap, which is a phenomenal contract that we have through the Ability One Commission of the federal government. We are the sole source provider. We make the cargo tie-down straps for the Department of Defense, and we just lost the presentation, but that's okay. In our, oh, you're back, Eddie. In our application, you will see that we have not had a strap order in 2 years. So that has been, you'll see that represented well in our financials. And one of the reasons also for us to really look at diversifying what happens in Cottonwood Industries. We want to invest. We've already invested in some automation so we can increase productivity. We could do more high level industrial type work that adds revenue and adds skills for the folks that are working in industries. So you will see that in our application. We obviously won't get into that today, but these are some of the things that we have made some significant progress already this year. The MAP program is a handful of years old. It was developed before I got here, but that has allowed us to bring folks in that are not IDD, but still have a significant disability. Traditionally, Cottonwood has served IDD, that's our niche. And now we have folks that have mental illness, that maybe have obesity or have some physical needs that really prevent them from being really successful in other organizations or in other jobs. Say Berry Plastics, for example, someone can't stand for 8 hours, and we can provide a little bit extra supports for those folks. So that's been really wonderful, and helping us integrate and just expand our capacity. Our life enrichment program has 2 different categories under it and another new one coming very soon, which is also part of our strategic initiatives and some of the growth we are working toward. But work enrichment, we have about 30 people that need more intensive hand-over-hand support. So they're not capable physically necessarily of working on the floor. I shouldn't say capable. I don't like that word, and I just said it. But who need a little bit more assistance and more one-on-one work. So we have a different staffing ratio for those folks. And then we also do activities out in the community. They have all sorts of different things scheduled. So they get a little bit of a balance between work and life things. Our retirement is wonderful. We have almost 20 individuals at a site here in downtown Lawrence that have chosen to not work any longer and have a little bit more leisurely way of life, which is wonderful also. But these are all pretty much work-based, and the new program is called CORE, Community Outreach, Recreation and Enrichment, and it is activity-based. It will not have a work component. And what this strategically is going to help us do or allow us to do is balance out those working in industries and then needing or wanting more of a recreational component. It's really super fun. They're doing all sorts of things. They went to Camp Mission Creek yesterday to look at some opportunities there in Topeka and developing all sorts of things. July 24th is our target date to kind of make that switch and really truly get that off the ground. It also helps us to meet federal and state compliance with, it's a federal law called the Final Rule about congregate settings and people being able to access their community on their own. So stay tuned. This is going to be fun to watch how it develops and just the creativity of the staff that are putting it all together is going to be really cool.
Can you
Yes.
back up and talk a little bit more about your retirement services and share, do you work with any of our other partners in that sector? So Douglas County Senior Services, can you just share that a little bit?
There have been, yes.
You know all the names
Oh,
better
right.
than I do.
They have definitely partnered with the Senior Services Center in the past. They used to go there for lunches. They do the lunch program that's hosted at Dillon's down the street. They've had partnerships with the library, the Humane Society, lots of different other organizations. Because again, even though, you know, a person's physical stamina may impact how much time they can be out in the community, the same expectation is there is that people have the opportunity to have activities come into them if need be, to have those kinds of services as well. So yeah, we've had a number of partnerships that have been great. The Arts Center
Yes.
is a really fun relationship. There's printing classes that are there a number of times a year. We've had music therapy classes. They're really partner oriented. Lots of
Parks and Rec.
activities.
Thank you. Yeah, I just asked because one of our jobs as a county commission is to sort of convene people who work in sectors to make
Right.
sure we're not overlapping
Right,
services
right.
or pay multiple times for services. So thanks for that. Appreciate it.
I have a curiosity. So what's kind of the split between like the number of folks that are working, that are in some of the working programs, employment programs, and some that are in the retirement program? And is that age-based or is it just individual decision?
It's for the retirement program, it is age-based. You know, there are other options for people who are younger than more of a typical retirement age if they want something other than work. That's what the core program is definitely going to offer. You know, over the years, there hadn't been as much flexibility or opportunity to look at day services that weren't kind of work oriented. So this, as Colleen said, this is a really exciting time. Cottonwood has always recognized the value of work, what that brings to a person's life, and all of the benefits that come with that. And so that has been a real value.
And will
of ours
continue
over
to
the
be.
years.
That will not ever go away.
But at the same time, those federal expectations are different. That final rule is specific to settings where home and community-based services are provided.
Right.
So the federal government has said that if we are reimbursing you for HCBS services, this is what we expect. And so, you know, this rule just went into effect in March. It will take some time to actually see how that operationalizes, but on paper, it says, you know, that a person with a disability needs to have the very same access and choices and autonomy as someone without. And yes, that is important. Practically speaking, as someone who has worked with people with intellectual disabilities for years, they need support with certain things. And a person's ability to make informed choices and to recognize the consequences of their decisions, that's as individualized as the people we support. And so frankly, there is some concern around how this final rule is going to impact things. And so we see it as possibly diminishing employment, work opportunities for people. This is very much around the work center with, you know, the 14C certificate from the Department of Labor that allows you to pay people based on productivity. I understand that to just look at that and for people to hear that someone is making less than minimum wage per hour for the work they do, that if you don't have the time or the interest to understand the nuances of that and the backstory of that sounds bad. It just sounds bad. But there's an individual, a young man who just graduated from C-Tran last year, profound hearing loss, severe autism. He, via our vocational rehabilitation, said at this point, they do not feel their services can support him in finding a job. In the school experience, he was working an hour or two a week at Checkers. He has come out to the work center and he has consistently earned over $1,000 a month on the contract work. It works for him. It's consistent, it's routine. Staff are familiar with him. I respect the work that professional advocates do, but he will not replicate that outside of a setting like Cottonwood. And if that has to go away for him, that's a tragedy. And that's a real threat out there. And so that's a lot of the interest we have around automating, being able to look at other contracts, to find ways to support our people to be as productive as possible, so that if that 14C certificate goes away, as many as possible will have improved their skills and their ability to work to the point that hopefully we're going to be able to provide employment and not bill Medicaid for it. Fine, we want people to work. So we're going to figure out other ways to replace those funds. And so this is a very challenging time. And so I don't know. I mean, I think we will have more people that may opt for a day of playing video games at the library, and that's what the regulations allow. And so we have to figure out how to strike as fine a balance on that as we can. But right now, CMS is not our friend. Hopefully they will be again at some point, but it's, the next year or two for us is really going to be really interesting.
Lots to navigate. Both at the federal and the state level. There's
Absolutely.
all sorts of things happening at, on both levels. So
Something I just wanted to mention back on JobLink too, is that in addition to the people with IDD that they are supporting, they're supporting people in Douglas County that have absolutely no funding associated to them. So again, that's where the resources that you all help provide, they still do follow-up for those individuals, but they were funded through vocational rehabilitation. Those were time-limited services.
good point.
They don't have HCBS funding that allows, some reimbursement for the follow-along, but our job coaches are still out there maintaining those relationships with the employers and are able to step back and help if something comes up. So just put that out there too.
No, I think that's an absolutely great addition and certainly a great point, saying that goes with Project Search. Also, we provide an employee that works Project Search, works with these individuals unfunded, as well. But we believe in transition. We have a phenomenal relationship with the school district, and, just helping kids transition. That's a big focus for us. And we believe they need to be connected before they leave, and we want to be that partner. So it's part of our mission, to make sure that happens. That was a long answer, wasn't it, Karen? So another one of the services that we provide is residential. We currently have 49 settings throughout the community, about 90 individuals that are either living in a group home or that we serve, anywhere from 24/7 awake overnight staff to someone going in once or twice a week and taking someone grocery shopping or helping with their budget, helping them, get their check to the bank or whatever the case may be. So this is a super, super neat program, and some amazing, we have amazing staff and amazing individuals that provide this service. This has been also a significant challenge, and this is a nationwide challenge in just the staffing crisis. The staffing crisis for direct support professionals really hit a few years, probably before the entire national employment crisis. And we've been dealing with this just across the United States, and getting folks to do this work. And those are new models that we as providers need to be looking at. And we've been participating and looking at a lot of different models. One of the things we really want to invest in next year is more technology and have more technology infrastructure. So we can do, we have the capacity to do different models and have different ways to communicate with folks. So this will be evolving over the next couple of years. Support services is our case management. We have 10 case managers on staff and 300 adults and children that we provide case management services for, in helping them access the services that they've qualified for through the CDDO, helping to link them to whether it's residential, whether it's work services, job link, or other providers. There are other providers in Jefferson and Douglas County that TCM refers to and works with. So it's not just Cottonwood, though they're part of us. They're really kind of a separate department that works with organizations all across Douglas and Jefferson County as well. So one of the next one and one that we are super, super proud of is our health supports. And I think this is so key to what we do and what we believe in coordinating and monitoring the health of the people that we serve. Some don't have family members or guardians that can really help guide their health care and keep them getting to those preventative doctor's appointments and dental appointments and things like that. And we do that for our folks. We believe that that is core to their everyday life, to their ability to work. We have an on-site clinic, so we have nurses on site that can help folks through some of the smaller things that they might need help with. And we have a wonderful relationship with LMH, with other medical providers. Bert Nash, I was not here during COVID, but what came together during COVID for our folks to be able to have access to Dr. Dodson or their psychiatrist, our nurses made it happen. Bert Nash made it happen. When I learned of that, after coming here, I was just absolutely floored. And there's very, very little state funding associated with that. We get a little bit for transportation, but we take people, we drive them to their doctor's appointments. And so that's the only funding we have for that department, but something we definitely feel is necessary to invest in. You can see from the slide, these are our funding sources. 61% comes from federal and state, which is pretty significant. Industries produces 24% of our revenue. Other is the 10%, and then between Douglas and Jefferson County, that is just 5% of our overall revenue. So I thought that was kind of a neat slide to show you guys too, to see. We're working really hard on other revenue sources as well. That this is a significant for us, don't get me wrong. But we are truly working to diversify those revenues, reduce our dependency on the federal and state revenues, and really grow that industries and grow our fundraising. We're looking at strategies such as major gift fundraising to renovate homes and investments in technologies, things like that. Those are all things that have been kind of on the table that we definitely are looking at.
Does the funding that we provide from the county, does that leverage any funding at the federal and state at all?
I don't think it affects it.
Okay.
It's not a match or anything.
Okay.
But these are just fun slides. This is why we do what we do. This is Yvette. She works at Cottonwood Industries, one of our highest producers and most successful workers, as well as she works at On the Rocks. So she gets to do a little bit of both. And she is amazing. She volunteers at Salute. She helps us with fundraising. She's super, super involved. You can see here, she's in our choir, dancing. We have a mini masters event on an annual basis that she absolutely loves to come to. Yvette's a great example of someone who accesses Parks and Rec. I went over to their house for dinner. That was kind of one of the strategies I had to just get to know folks. And so I went over and had dinner at the home that she lives in. She's like, well, I gotta go. I'm going to yoga. So she's just priceless.
Yvette, I am so sorry. Um, so back on the 14C, the law requires that qualifying employers can pay that percentage, but it's based on a prevailing wage for the region. So it's not based on minimum wage. And the prevailing wage in our area is, I think it's $17 an hour, somewhere around there. A vet's productivity-based wage at Cottonwood is $10 an hour. So she's not working at 100%. She's working at 50 or 60%, and she's making $10 an hour out there in addition to her job at On the Rocks. And I would guess that that is comparable to what she is making it On the Rocks.
Yep.
So at the risk of putting you all to sleep, this really is a significant issue that's going to be ahead of people. A vet is unlikely if the Cottonwood 14C option, and it's probably not an if, it's probably when it goes away, she is not going to replace those hours in the community. So right now, between her job at On the Rocks, that is probably 4 or 5 hours a week, and they love her. She's recognized across the city. So it is huge and invaluable. She's going to lose the other 25 hours of fairly paid employment that she has now, potentially. So it's something. Okay, I'm done.
No, I actually really appreciate, because I think that's one of the reasons why, I wanted to have this work session, because I think there's a lot of really substantial changes on the horizon potentially for Cottonwood. And it's important for us to understand the impact that will have not only on our community members, but also, and then that will have other impacts throughout the community.
Absolutely.
Right.
So I don't know if you all have looked at our supportive housing needs assessment. Maybe we had 6 months ago. Does that sound about right? Housing for the populations that you work with, what can you tell? Did you see that needs assessment? Do you feel like your populations were included in there?
We did see it, so
Okay.
thank you. We have a number of people that we support that do live in privately leased apartments. So for those individuals, safe and affordable housing is absolutely an
Critical.
impact. But for those individuals that live in group settings of some sort, Cottonwood, we either build the home, and so it's there for the individual. We leasing sites is a tricky situation, and different communities have done different things. But if a provider leases a site, it's looked at by the state fire marshal the same as an owned property. And so there's the sprinkler requirements, there's the egress requirements. So we have kind of gotten out of the business of leasing. There's work that can be done to help the individuals that live in the home lease, but that's really messy too. I have 3 leaseholders in a single house. So yes, for people who can live pretty independently and have their own settings, options are limited. Most of our people are eligible for either the project-based assistance. So like Clinton Place or Prairie Ridge, several of our people have vouchers. But we have found, and I know that this is what you have found all across the county, that landlords are getting out of the business. They're selling them to out-of-state people that don't have the same kind of commitment. And there's frustration and inconvenience that comes along with being a landlord that accepts the voucher. And we've had at least 2 people in the past year that have been in that circumstance, that the owner changed. They were given a period of time to find something else, and they're in places that are safe and meet their needs, but it was a big disruption, and they aren't as as nice of a place that they came from. So yes, it's certainly an issue.
But that's some of the services that you provide your clients is to help them
Fine.
get that
Yes,
housing.
yes, absolutely. Yeah.
Is there anything that you think we can do? I mean, a lot of those things may be city regulations, not necessarily county regulations, but are there things you think that we could do from a policy standpoint that would make it easier? And you don't have to answer now as you think about it.
Okay,
see
I
some
will
board
think
members-
about
yeah.
that. Nothing readily comes to
Okay.
mind, you know.
We've had some discussions with the Housing Authority with Shannon and Chrissy, and like we should be, you know, at least relational and understanding what each do. We haven't come up with any grand solutions, obviously. But we have had we've embarked upon some discussions.
We loved it when the local fire department inspected all of our properties because they did know us. They had confidence in our training, in our drills, and how we maintain our properties. So they were comfortable with coming out and doing those inspections, but a number of years ago, because they weren't required to any longer, and I think that there was some kind of conflict with the state fire department, fire marshal. The state fire marshal now inspects all of our properties that are 4 or more people. And so we still have a wonderful relationship with the local fire department for a couple of our little small houses, but most of it is the state fire marshal. And because we are so compliant and so safety conscious, the properties we own are in great shape as far as fire regulations go. I mean, we've invested in sprinkler systems, we staff accordingly, we do all of those kinds of things, but that's expensive.
What's the number in group living setting that requires the building to be sprinkled? So 3 or 4?
4 or more, and it's
Four.
based on evacuation times 2. And so if you can show that consistently people are evacuating, I 3 minutes, I think it might be, I'm not sure.
I
But
just
so it-
reviewed all those drill reports, but I can't remember either.
So it is a combination, but it's, you know, and there is a lawsuit in Johnson County that is making some progress that argues that is discriminatory toward people with disabilities because we aren't held to that. And, you know, so there may be some progress there, but it further challenges the housing pool.
I was going to say, is that a state regulation?
It's a state interpretation of the fire code.
Got it. So it's not a local
No,
interpretation.
no.
Got it.
You want
Well,
to
you
tell
can
us about
see.
Salute? Yeah.
Eddie threw that one in, of course, but this is obviously kind of our signature fundraiser with the Mass Street Mosey, the winemaker dinner and the grand tasting. This is a phenomenal event. It's not only a fundraiser, but a friend-raiser because of the numbers of people that attend and the numbers of people that we get to talk to and connect with, you know, about what we do. Last year was my first one. I was just overwhelmed by the number of people that I met and just got to hear all the wonderful things about Cottonwood and how lucky I was to be here. So it was super fun, and I'm certainly looking forward to this this coming year.
Well, that's right at the end of our budget hearing. So I'm sure that would be welcome by the county commission.
Well, we would love to have you, and we would love to have you guys come take a tour. I mean, I know you guys have been there in the past, but I think you'll see just in the last year, well, not just the last year, but the automation and progress with our cargo strap line. Engineers from Source America came out and helped us set up conveyor belts to move product. And all sorts of really neat things. So I think you'll see some good changes, some big changes. And we would love to have you. Our folks love visitors. So our production staff don't like it so much when we bring visitors because it gets them off task and then they have to redirect. But I think it truly is a good thing for folks to see and
I know you've brought some board members. I just wanted to ask kind of in general, how do you reflect lived experience of our IDD population on your board?
So we actually have one of the consumers is a member of our board. So Perry Buck, he works in Cottonwood Industries and he has residential services from another provider, but he actually serves on our board. I drag them out on the floor all the time, but you guys feel free to. That's right.
And have consistently.
Yes, yes.
And is that part of your bylaws to have those positions kind of make sure that those are always filled?
I actually just read in detail the bylaws today, and that is not in the bylaws. It's just
curious.
something we value.
Nice.
I certainly can't take credit for that because it's been going on for 50 years, long before my time, but this board is truly unbelievably committed in attendance at board meetings and asking questions. When I first came on, we worked through, and Sharon also, my predecessor, we worked through kind of what's Colleen's focus, going to be and what are those strategic priorities going forward? And these guys held my feet to the fire and but it's good, it's good dialogue. It's, healthy conversation and they're definitely involved.
Maybe one more question since we have a
Please.
few more minutes and we're talking about boards. One of the things that our board has asked a lot of boards is the diversity of your board and does it reflect the population that you serve? Can you talk a little bit about that?
That's a struggle. Diversity. We have a very, very good balance from a gender perspective. But and pardon? And yes, and definitely age perspective, but we did do this year, just kind of do a board demographic analysis and start as we go into nominating committee at the end of this year, we're looking at what do we need? So we look at profession, experience, all those kinds of things as part of that analysis. But we know we have work to do. We definitely know that we have work to do.
What's the diversity reflected in the population you serve?
Is, and we can get you actual percentages, but we serve people from a pretty wide spectrum of backgrounds and life experiences, and it is diverse as you come through now. So yes, it is.
I don't know that I don't know that I know the data off the top of my head, but just looking, we're pretty good.
It is also an aging group that we are serving, quite a few of the individuals that we still support started 50 years ago. I mean, we have had people that have chosen Cottonwood for their whole lives. And so just like most of our nation and the world, I think there are people that need support that are getting older and those needs change. And that's a lot of what we are seeing as well. But we're also seeing more younger people coming in and it is a diverse place.
Commissioners, any more questions? All right,
We have one little video. Can we show a little video?
sure, yeah.
This is the fun stuff. And I think you'll see some diversity in here too. So, yeah. That was our case management staff on Halloween. So that's our ending video. Why we do what we do.
Well, thank you very much. We appreciate what you do. Thank you, board members, for being here. Appreciate your service to the organization. Appreciated the update. With that, we will adjourn until our 5:30 business meeting.
Thank you
Thank
guys
you, everyone.
very much for having us. Really, really appreciate it.